Many children will welcome the return to school routines and classmates, but others will find the numerous changes more difficult. We can help children transition by listening to their concerns and by being honest about our own. I would like to thank provincial authorities, local school boards, and educators who have been working overtime to reconfigure schools in order to lower the risk of transmitting the virus in these settings. Although Canada is striving to maintain a slow burn, the average daily case counts has been increasing in recent days. This is concerning, and I want to underscore that when cases occur, including in schools, it is a reflection on what's happening in the community. So the key to keeping COVID-19 at a manageable level is for each and every one of us to keep up effective public health practices at home, at work, and in the public spaces we frequent. Finally, I would like to take a moment to say a few words to parents, caregivers, and guardians. You are doing your very best you can right now, and there is no one-size-fits-all approach to a child's learning. Decisions are not made lightly. So to all of us, kind words, encouragement, and letting a parent in your life know that you're there for them can be a lifeline. There are also mental health resources for parents and children on Canada.ca, and there are other mental health resources, including the Kids Help Phone, Families Canada, and Crisis Services Canada that provide invaluable support. Now is not the time for complacency. To reduce community transmission, keeping up with public health measures such as frequent hand washing, physical distancing, and wearing a mask or face covering are key. Thank you.
Bonjour. Comme Dr. Tam.
Hello. As Dr. Tam said, I hope everyone had an enjoyable and safe long weekend. Schools across the country are starting the process of welcoming students back today. I'd like to say a few words about how we can all support each other during this time. But first, I'll begin with the usual numbers update. There have been 132,142 cases of COVID-19 in Canada, including 9,146 deaths. 88% of people have now recovered. Over the past week, close to 46,000 people were tested daily, with 0.9% of people testing positive. An average of 545 new cases have been reported daily during the most recent 7 days. Many school districts across the country are starting to welcome students back, whether in person or virtually. The transition back to school for children and families can be stressful under normal circumstances, and we know this year will present very real and new challenges. Schools, classrooms, and shared spaces will look fundamentally different, and teaching methods will vary. Many children will welcome the return to school, routines, and classmates, but others will find the numerous changes more difficult. We can help children transition by listening to their concerns and by being honest about our own. We would like to thank provincial authorities, local school boards, and educators who have been working overtime to reconfigure schools in order to lower the risk of transmitting the virus in these settings. Although Canada is striving to maintain a slow burn, the average daily case count has been increasing in recent days. This is concerning. I want to underscore that when cases occur, including in schools, it is a reflection of what is happening in the community. So, the key to keeping COVID-19 at a manageable level is for each and every one of us to keep up effective public health practices at home, at work, and in the public spaces we frequent. Finally, we would like to take a moment to say a few words to parents, caregivers, and guardians. You are doing your very best right now, and there is no one-size-fits-all approach to a child's learning. Decisions are not made lightly. So, to all of us, kind words, encouragement, and letting a parent in your life know that you are there for them can be a lifeline. There are also mental health resources for parents and children on Canada.ca, and there are other mental health resources, including the Kids Help Phone, Families Canada, and Crisis Services Canada. Now is not the time for complacency. To reduce community transmission, keeping up with public health measures such as frequent hand washing, physical distancing, and wearing a mask or face covering when in public are key. Thank you.
Thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une des langues officielles.
You can ask your question in the language of your choice.
Only one follow-up. For those asking a question in the room, we do ask that you make your way over to the freestanding mics. Operator, over to you for the first question.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. And our first question, notre première question est de Jordan Press from the Canadian Press. Please go ahead. Your line is open. La parole est à vous.
Good afternoon. Dr. Tam, just picking up on what you talked about with children going back to school in many parts of the country today, can you just talk about what are some of the signs or signals that you may be monitoring to see if, as far as caseloads, as far as that back-to-school plan goes, what will you be monitoring to see if we are on a best-case trajectory and maybe what we should be looking for to see if that trajectory is heading in the wrong direction?
Yes, so as I've said, that it's important to keep the community transmission at a manageable level if you don't want to see cases in a school or, in fact, the potential for actual transmission in those settings. So I think some of the key indicators which we've been monitoring for some time is not just the daily number of cases, and they go up and down, and sometimes people don't report at the weekend, sometimes they, so today we expect to see some of the numbers go up, is that we're looking at the number of cases averaged over the last week and really looking at the trend and to see how fast those numbers are increasing. We also have to look at who are impacted by COVID-19 at any given moment. We know that in the last days and weeks, it has been younger adults, the sort of 20 to 29, and then the 30 to 39-year-olds. And so because they are increasing their mobility, getting back to work in certain circumstances, that's important to watch for because any public health action is dependent on knowledge of which demographic, which group the public health action should be targeted at. I think we're monitoring the kinds of outbreaks and the numbers of them. So what has been evident and a bit different from in the first wave at this point in time is that there are still long-term care facility outbreaks and they are, and cases in them, but they are now much smaller than the previous wave, and so I hope that's a sign that we've learned something about protecting those highly at-risk settings. But we have to watch that really carefully because, again, the acceleration in transmission and acceleration in severe morbidity and mortality will be if there's a shift in that into those high-risk settings. I think what we need to see when I said we're looking at the kind of outbreaks is that what you don't want this virus to get into a setting where the high degree of transmission, sometimes called super spreading events, can occur. Those sort of crowded and closed environments where people are gathering and where they're not observing public health measures, or where you have to help them adjust their protocol so that they can better manage. And so, but the most difficult part, I think, and that we're watching for in the kinds of outbreak is the fact that there are private functions and family gatherings where we need to, make sure that we support every person in this country to know what to do to minimize the risk, like reducing the number of contacts. So all of those things are more the epidemiologic parameters, and we've been monitoring, as you know, the reproduction number, which is the RT, so seeing where that is going. That's going up and down. It's now, I think, at the national level, because of what's happening in the larger provinces, is hovering above 1 now, which means one person is transmitting to over one person, just over. That is not a good sign. Don't want that to happen. So that has to be monitored very carefully. The other signals of potential for acceleration of transmission is sort of the turnaround time of the public health systems, contact tracing, and testing. So we're asking for provinces to see if they can give us an idea of how they're doing, because that matters in breaking chains of transmission. And public health can't do their jobs unless people present for testing and present for contact and support contact tracing. So it's quite a complex piece, but the bottom line is we know what has worked, and we really have to keep applying that in the current context to keep transmissions low. So this week, I think, is a really critical week, and for sure next week, because then you would have had some idea of what happens when you go back to school. So the next couple of weeks is 2 weeks of careful vigilance.
Thank you, Dr. Tam. Jordan, follow-up?
Well, I just wanted to follow up with the idea that if you have all of these kids, and being a father myself, I kind of understand what it's like when suddenly you put a bunch of kids together and one gets a sniffly nose and then everybody gets it. And so I'm wondering, how then do you foresee the country testing, all these kids who are going to be in close contact, to know which cases we need to worry about, or which symptoms we need to worry about, which symptoms maybe we don't need to worry about as much, so that we don't overwhelm testing capacity, and you don't have parents maybe every other day suddenly lining up with their kids to go get tested for COVID-19.
Yes, so I think it's a combination of factors. One is knowing what viruses are in the community, but it's true that COVID-19 is a particularly difficult virus to deal with because its spectrum of illness is sometimes really vague. And so I think, the prudent thing when someone is symptomatic is keep them at home, don't go to school, but also call up the local public health hotline and figure out if a child needs to be tested. And so I think it is true that we would have to test for more than one virus, probably, just to figure out whether it's COVID-19, whether it's RSV, whether it's influenza. That's going to add a layer of complications to the kind of testing. We're also looking at how to augment the testing capacity and make it more accessible. And so provinces are trying to do that with support of the federal government. But we do, I think in the last week, people have talked about, well, what about saliva testing? What about other modes of testing? I think, looking at what tests are most effective in the pediatric population is a gap that we have to fill in terms of the testing modalities. And so I think that's another aspect that we have to sort of layer on in our testing landscape. But you're right, it's not going to be that easy. But I think reacting very quickly to an initial individual with any kind of symptom remains a very much the cornerstone of our response. And so I think there's no really easy answer, but, elevating access to testing in the context of a virus with a wide spectrum of symptoms is a challenge, but one that we have to sort of keep up with.
Thank you, Dr. Tam. Operator, next question on the line.
Thank you. The next question, la prochaine question est de Michel Lamarche de TVA. Please go ahead. La parole est à vous.
Bonjour. I'll ask the question in French, but Dr. Tam, if you want to answer, please feel free, either in French or English. I just want to ask you, est-ce qu'on est présentement dans la deuxième phase?
Are we currently in the second wave? If we look at concrete criteria, are we in the second wave of the pandemic?
Peut-être je commence.
Perhaps I'll answer. It's Dr. New here. According to the data that we have currently, we're not in the second wave. We're just seeing an increase of cases in Canada. There are more cases throughout the country, and this is concerning. Public health authorities in the provinces and territories are closely examining what is happening in their different administrations. This is something that we're going to have to keep an eye on over the next 2 weeks with schools reopening. If there's another increase over the next 2 or 3 weeks, it might be an indicator that, yes, indeed, we're seeing a new increase of cases in Canada. Perhaps Dr. Tam has something to add.
Just to add that people sort of keep asking us about, is this another wave, etc. So I think what we're monitoring is whether there is a resurgence, as Dr. New has said, is a bit sort of academic to describe one wave followed by another wave. What we will be looking for is whether, we are going to keep these numbers at a relatively low level that public health can manage while still balancing societies being able to be open. So I think we are seeing this sort of up and down since, the July and August period. And what we're trying to avoid is a rapid resurgence. So I think the next 2 weeks is not just a reflection of maybe schools or colleges, but also, of course, this last long weekend. And if there's been any other gatherings that has potential to spark any new change in transmission. So I think, terminologies will change over time, but right now what we're focusing on is there going to be a full resurgence as a result of increase in interactions?
Thank you. Drs. Michel, follow-up?
Oui, sur la reprise des cours dans les écoles.
Regarding courses, classes in Quebec, for example, there are 118 cases in the different schools of the province. When does this become concerning? What are we trying to look at to see if we're on the wrong path? And how do we see if we're going to see an explosion in cases? Answer, it's Dr. New. Thank you for the question. As Dr. Tam and I have said, what happens in schools reflects the epidemiological situation in communities. That's why it's important, yes, to follow up on what's happening in schools, but we also need to look at what's happening in communities. We're always looking at the number of cases, the infection rate as indicators. We look at the reproduction rate as well. In Canada, it's just over 1, and that's not good. We want to keep the number below 1 for a long period of time. I think that in schools, it really reflects what's happening in communities. Now, for schools, what we're seeing now is that if a case was caught, it means that our public health system is working well at catching this, but we need to know if there are 2 or 3 cases that are linked. with all the public health measures in place in schools, we're waiting for schools to work with public health authorities to maintain their management plan for these cases, because we need to understand that there will be cases in schools, but the matter is to know, what do we do if there's a case or two? We need to manage this at a local level, and we will continue to work closely with our provincial and territorial counterparts and local health authorities to see what is happening with cases in schools. Thank you. Thank you, Dr. New.
Thank you. Merci. The next question. La prochaine question est de Cormac McSweeney from City News. Please go ahead. La parole est à vous.
Yeah, this question is for Dr. Tam to start off. The federal health minister has launched an independent review of decisions made in late 2018, early 2019, as reported by the Globe, that effectively shut down the global public health intelligence network, which some argue could have given us more data or better early warnings to COVID-19, as well as complaints of scientists and researchers that their concerns, messages with important data not making their way up the chain of command at the public health agency. So can you explain the reasoning behind the changes to the Global Public Health Intelligence Network back in 2019? In your opinion, did it disrupt the ability of the government to properly prepare for COVID-19? And what is your reaction to the complaints about the flow of data within your own agency?
Yeah, so the Global Public Health Intelligence Network continues to function, but I think, again, like any other system, I think we have to look at lessons learned and look at its place in as we move ahead. So I think the purpose of an independent review is so that whoever the reviewers are can do the job. So preempting what their findings are, I don't think is very helpful at this time. And I think the president of the agency and certainly myself and the minister in particular will look towards what the findings would be. But I think with the purpose that we strengthen early warning and, globally, and whatever Canada can contribute to that, I think would be very helpful.
So just as a follow-up, do you think that it impacted in any way the early warnings for COVID-19? And then also just on the student issue, to follow up on what Jordan Press was asking earlier, are you concerned at all about the number of test kits in Canada and the stock that we have if we do see an influx of parents and students having to go get tests in every province when symptoms start to show at schools?
Yes, so again, to your first question, I would say that whatever I say, I should probably leave it to the independent review. I mean, I know that I got my email from GFIN, as soon as they noticed something, which was around the December the 31st, January 1st time frame, and to which the province and territories were communicated to as well. But I think, as I said, I think the minister will look forward to what the findings are, and we will address any findings and recommendations accordingly. But from a domestic perspective, I know that we did get the message about the initial media report of the cluster in Wuhan. And on the second question, I'm trying to remember it now. Testing, yes. So we know that right now, using the current system of testing, which is what we call a PCR-based testing, and generally requires a nasopharyngeal swab and the sample being sent to a lab. That system capacity is still there and is right now we're testing about 46,000 people a day. We know that the capacity is definitely beyond that, and there's no surge of that capacity at this point. We do have to continue to strengthen, I think, the kind of testing technologies that we can provide to more remote communities. Some of those point of care, near a patient testing that doesn't involve sort of flying a sample somewhere into a major center. That's also been strengthened. But I think what we're interested in is that could there be other new testing modalities that could be added to this current platform that would also make it easier, more accessible, I think, for testing purposes, because it's all very well looking at the gross capacity, but access might be different depending on where you are in the country. And I think it would be really important to make sure any school or any community have rapid access and turnaround time to COVID-19 testing.
It's Dr. New. Maybe I'll just add a little bit to the first question in terms of information flow, GFN, et cetera, within the agency. I think within the agency, Dr. Tam and myself, we rely on multiple sources of information. Certainly, both Dr. Tam and myself, internally, we got our GFN alert about this unusual pneumonia cluster in Wuhan, China. But we also have multiple other sources. I would say that the global public health community is very connected, and we were exchanging information with colleagues and organizations around the world. Everyone was picking up signals, and by sharing that information, it reinforced the point that something unusual was happening in Wuhan, China, and the rest is history, of course. But I just want to, I think, emphasize the point that it's not just any single system or information source alone that we rely on. It's really, I think, an integrated system throughout the world. Thank you.
Thank you, doctors. We'll now turn to the room for the questions. Start over here.
Bonjour, Louis Blouin de Radio-Canada.
Louis Blouin from Radio-Canada. My question is for Dr. New, but
answering in English also, it will be welcome. Croyez-vous qu'il serait pertinent de commencer?
Do you believe it might be relevant to do random testing in schools? In New York, in the United States, they started doing this. Would it be an idea to do that here in Canada? Answer. Thank you for your question. It's a good question. I don't think we can compare the situation in Canada with the situation in the United States, because things are quite different. I think this is a valid question. What's happening in schools reflects communities, and so it's important to follow what is happening in communities. What's happening in schools is a part of what's happening in communities. We could ask the same question of companies and workplaces. Is this an option to have random testings for staff? For now, I think it is more important to test people who are at a higher risk of infection, of transmission. We are open, however, and we continue to discuss this issue with our provincial and territorial counterparts. And with science and data, which is evolving in the world, we are going to continue to talk about this. But I think that at the end of the day, it's the provinces and territories that are going to have to decide this. We have to look at risk tolerance at a local level. Thank you. Dr. Tam, if you have anything to add, go ahead.
Well, I think the question was about sort of more regular testing. I think, again, we'll keep examining testing strategies going forwards, but right now with the platform and the kind of tests that we have, the key is to focus on diagnosis and those with symptoms. As you've heard from other questioning, that it could be all sorts of symptoms, even a sniffle, and then someone might have to get tested. What is really important at this stage, we'll continue to explore other testing strategies, But I think that to date has been successful in breaking chains of transmission, and we should continue to do that. In a system whereby, it definitely still has surge capacity, but not limitless, you also want to make sure that you can prioritize persons who are sick as well. So in those kind of systems, you need to be able to sort of label those tests accordingly. But I think we're continuous to examine that approach. But I think, as you've just seen, provinces are reporting even singular cases from schools right now. So we believe the system at the moment is working. So I think but I think as more opportunities arise for different kinds of tests, we'll keep re-examining the applications.
Quand le vaccin sera disponible, est-ce que vous avez un plan de vaccination?
When the vaccine is available, will you have a plan for vaccination? For example, who would you want to get vaccinated first? Children, maybe? Seniors? Frontline workers? Who are the people who should have access to the vaccine first? And who will decide? Will it be you? Will it be provinces? How will that be done? Answer. Thank you for your question. At the agency, we have an advisory committee. It's called the NACI in English. And the members of the committee are health professionals, and they are currently analyzing the data, discussing all of the data, and they will be working on a plan regarding priority groups for a vaccine. And we hope that we have this vaccine soon. At the agency, in the government, we are going to look at these recommendations. We will discuss with the committee members from the provinces and territories as well. Next question.
Dr. Tam, Michael Couture with Global National. I wanted to go back on the GFIN story. Minister Haidu herself has acknowledged that scientists did not feel fully empowered within the department. And I wanted to ask you, A, how dangerous is that? And B, when did you hear that they were feeling like they were no longer being empowered? And how did you react to it?
Well, I think we, as I just said, that we did get, I get reports from GFIN every day, and I read them, and I hope that my staff knows that we actually do read them. But I think from my perspective, it's very important not to have, to have as minimal a delay and minimal number of layers of, bureaucracy, if you like, in a system which is meant to provide an early alerting. So again, I haven't not, looked into the system myself, and I think, as I said, I look towards the independent review. We, as I think I can speak on behalf of the vice presidents and the president of the agency, that any difficulties of public servants or our staff in expressing their views and their concerns has to be taken really seriously, and that, I think, management has to be able to address any concerns from our scientists. And I think we got an incredible group of scientists. You can see how passionate they are about their work and their system, and, we're grateful for their work. But if there's any sort of changes that reduce efficiency, we need to know about them. So I think, I certainly welcome any kind of review that improves the system. But from my perspective, as user of the intelligence, I did get the email that I normally expect from that team.
Your follow-up?
So I'm just trying to figure out, so in your mind, has the efficacy of the system not changed at all? Have you not noticed any either delay in the reporting, or have you not noticed their potential complaints about feeling like they aren't being heard?
I think, again, I really don't want to preempt the findings of the independent review. No doubt the managers of the agencies will get interviewed as part of that process. So I think I would like that to be sort of taken as objectively as possible. But I think, staff should feel that they be able to articulate any concerns and difficulties as they should in any organization. So, they have not specifically talked to me about it, but I play a very different role, if you like, to some of the line managers in the agency. But I know that they would want to be able to hear any concerns as soon as possible. So we encourage all of our staff to do that.
Thank you, Dr. Tam. Next question.
Bonjour, Dr. Tam, Dr. New, Catherine Lévesque de la Presse canadienne.
Catherine Lévesque from the Presse canadienne. I would like you to give your thoughts to a regional approach to press conferences on cases in the province. Do you think that this is a good idea? And do you think other regions in Canada, other provinces, should apply the same model? And do you know if some are already thinking of such a model? Thank you. Answer. Thank you for your question. I'm not aware of all the details of Quebec's announcement. This is something that we've said multiple times. Managing COVID-19 is more important at a local level. It's hard for us to give a snapshot of all of Canada. If Quebec wants to move forward with a system to have good data at a regional level, well, then that's good for everyone. And for public health authorities in the region, they could continue working. I think that if everyone is well informed, if there's an outbreak, for example, in a specific area following an event, well, we'd be able to highlight to people, hey, you really need to maintain and keep up with these public health measures. We'd be able to see that some people perhaps have not been practicing these public health measures properly. So this is something to say at a local level that wouldn't necessarily need to be said provincially if it's a problem in a specific region. So it's a good initiative on the part of Quebec's government. I think that something similar is happening in other provinces and territories, not necessarily in exactly the same way as Quebec, but we are continuing to work with our counterparts in the provinces and territories, and I think that the provinces and territories all have their own system. And the public health administration is always different from one province to the next. I think that we have a good relationship with public health authorities of the different provinces and territories. And we share the information and make the information public. When I was talking about regional alerts, I was talking about color codes regarding the severity. So we could talk about lockdowns, regional lockdowns, if ever there was an outbreak, for example. And my follow-up question now is that 3 Quebec ministers are currently in quarantine after meeting with a mayor from the region of Montreal. There are politicians that are traveling more, and perhaps they're not following the guidelines properly. For example, Minister Champagne. Do you think that politicians should be leading by example? Answer. Thank you for your question. I think that the role of politicians is important, but they also need to interact with the public. That's part of their job. It's important for anyone, for a politician, for myself, for Dr. Tam. We always need to be conscientious, and we need to follow public health measures. You always need to wash your hands frequently. You need to maintain physical distancing. You need to wear a mask or face covering if you can't maintain physical distancing. So this also applies to politicians. From what I've seen of politicians is that they've reacted well. We don't shake each other's hands anymore. But it can be difficult. I think that everyone needs to take responsibility. They need to protect themselves and protect everyone else. Thank you, Dr. New.
Operator, we'll go to the next question on the line.
Thank you. The next question, la prochaine question est de Paula Newton from CNN. Please go ahead. La parole est à vous.
Hello, good afternoon, and thanks for taking my questions. The first question I just wanted to know was about the current death rate in Canada. I mean, we know that tragically 4 of every 5 deaths in Canada were linked to, the outbreaks in long-term care centers. I've been having trouble disaggregating the most recent information, though. What is your understanding about if there's been an improvement in the actual death rate, and has that gone hand in hand with an improvement in what you see as the hospitalization rate?
So, we report on the sort of daily numbers of persons who have been essentially diagnosed with COVID-19. So those are the cases. And then the deaths are also reported to us from provinces and territories. So what we've noticed, and as I've just said that earlier, that right now the age group that seems to be most impacted or have the highest numbers and reported are in the younger adult age group. And what we know is that younger people can get seriously ill, but at a lower risk than the seniors. So I think that's what we're observing. And right now, therefore, the number of deaths reported per day is nowhere near what they were at the height of that first wave in Canada. So, but, this is really a note of caution, is that we have to monitor very carefully any shifts into the older age groups as viral transmission increases in the community if we don't break those transmission, and the outbreaks in long-term care. But long-term care facility outbreaks appear to be smaller in the size in general than they were at the last time we encountered the tragic outbreaks in that initial wave. So I think that's what's characterizing what we're seeing right now. I do think that much has been learned for seniors' residences long-term care, but I'm sure that more could still be done, and that's very much at the sort of local level. And it's a really important thing to do before we get into that sort of fall-winter season.
Thank you, Dr. Tam. Paula, follow-up?
Yes, just to follow up on a couple of questions my colleagues asked. I mean, you did, even in your opening statement, say that, private functions, family gatherings were still a cause for concern. I do believe, though, throughout all the provinces, and I understand each province has their own public health measures, there is a lot of confusion. I think many people are having private functions. They are having family gatherings. They don't believe what they are doing is they're definitely not illegal, and certainly not even against public health measures. So as you look at the numbers today, with what you say is a concerning increase, is it time to tell people to knock it off? Stop having a family birthday party with 30 or 35 people in your house, even if technically it might be legal.
Yeah, I think, local authorities will adjust their policies, but what you say is, I think, an important message in that you have to keep your contacts low. You can have a small birthday party. Now, technically, if you were to have a bigger party, you're meant to keep still within your immediate, family contact and be and socially, physically distance and observe those other measures. But it's an awfully difficult thing to do probably in your own private setting. Restaurants might have a certain set of rules about how you sit down, don't move, and everybody who is serving you is wearing a mask. Bars, you're not allowed to go up to the counter and get your own drinks. Those kind of rules are probably quite difficult to apply in any kind of private setting. But if that's the case, then really think twice about having any kind of larger gatherings. It can probably be done safely, but it takes an awful lot of planning. And, I think some of the practices that we're seeing in other public spaces, people need to maybe translate them if you're going to have any kind of family gathering. But you're correct in that anything larger than, a group of people that can be managed in a tight sort of close contact clusters is really difficult to do. So big weddings, that kind of thing, those have to be really carefully managed. And if you're not certain that the planning is done where physical distancing and sort of, the concept that just because it's people you shouldn't sort of let your guard down is a really important sort of concept to have. But, we also recognize that cultural events are important in people's lives, but we got to be able to sort of figure out how to do this in a safer way. But I have no doubts that if my colleagues at the local level are seeing things go a different way, they will sort of look at changing their stance or policies if that should happen.
Thank you, Dr. Tam. We'll now turn to the room for questions. David?
Hi, David Thurton, CBC News. I know you answered this in French last week, but I wonder if you could provide a response in English, Dr. Tam. Are school buses safe, especially where, some buses pick up students from multiple schools? They might not have the time to clean them. And as we get to the colder months, they might not be able to open as many windows. So is there anything you want to tell parents and students about the safety of school buses?
Well, just like in any other sort of situation, there's never zero risk, but you can reduce those risks. So I think, obviously there are alternatives to busing, so you can try those and keep as active as you can with active transport, cycling, walking wherever you can. Even winter, if you are close enough to your school, you could do that. But some people don't have a choice. So school buses should have assigned seating. You could be next to your family member, for example, but with appropriate distancing from others who are not, sitting right next to you. So, and wearing a mask when you're inside the bus is, one layer of protection as well. So, but the most important sort of preparations, in fact, is before you get on the bus, which is don't let any sick kids on a bus. And, those kind of measures pre-bus and post-bus is probably just as important as the journey itself on the bus, which is probably quite a limited amount of time. But if people can be seated relatively still, not moving about, mixing, wearing a mask, keep to your family cluster as much as possible, all of those things will reduce the risks. And washing your hands, all those things after touching, surfaces like the bus is another layer of protection. We're still trying to figure out how important fomites and surfaces are, but it's still prudent to wash your hands and clean the school buses as well. So I think, all of those layers of protection will be important, but we recognize that some kids don't have a choice. They have to take the school bus. So all of these measures can be done to reduce the risks. But, I do think that assigned seating, making sure people are not moving around, wear a mask, wash your hands, don't let anyone who's sick, can be effective at reducing the risks.
Follow-up, David?
Yeah, and just a totally different question.
Well, the other thing is, depends on how your school is organized. So if you're with your classmates and you're a part of a group or a pod, then you're already in a sort of cluster or a pod that, normally is expected then to move into the school. So post-bus, you're part of that group, or you're with your family, which is your pre-bus sort of contact. Then try and group people in those kind of settings might also, help manage risks.
Okay, thank you for that. A question on a totally different topic. When you look at the science, when you look at all that you've learned about COVID-19, do you still consider it a respiratory virus, or is this now a vascular disease or sickness?
I think it can probably be both. So depends on how you classify it. It is a respiratory virus in that the human-to-human transmission aspect of it is most likely through respiratory droplets, and that still starts. I think science is evolving in terms of how the virus, once it gets inside your body, can impact your health. And there seems to be a every day you read the scientific literature, this virus seems to be able to have an impact on the multiple systems in your body, including your cardiovascular system, including your sort of inflammatory response, how your blood vessels may be inflamed, etc. So I think that it is a respiratory virus. It's transmitted through there. It definitely can affect your lungs. There is no doubt about that. But it can also have other effects, which we're still continuing to learn about. Some of these effects might be acute, but others could last longer. So that's another area of ongoing scientific pursuit as well.
Thank you, Dr. Tam. Final question, Mackenzie?
Hi, doctors. Mackenzie Gray from CTV News. To go back to some of the questions earlier, Dr. Tam, about the Global Public Health Network and the closure of the early pandemic warning system that was put into place there, did the minister at the time ask your advice on whether or not it should be closed? And if they did, can you tell us what your advice was?
So GFIN was never closed. So the system continued to function as far as I have any, or the knowledge that I have. I think there was a question about whether it's sufficient to send out the daily reports, or that there is an alert, which is an additional function, which goes more broadly than the Canadian domestic context and our partners. And so the alert meaning it could go broader into the international arena. But the GFIN information is sent to our international partners like the WHO and others as well. So I don't think there was ever a shutdown of the system as such. So we have to go back and, the program exists. There was as it stands, but I think the review will look at what actually happened to those specific alerts as opposed to the regular daily reports. And so, and whether they would have reached a different audience or a broader audience, I think will be under review.
My follow-up, you mentioned earlier on that you first learned about COVID on either December 31st or January 1st. That was the same time that media reports came out about COVID-19. So is that fair to say that you learned about COVID from media reports and didn't have any pre-advanced knowledge outside of what had been reported in the media? So
the GFIN network picks up on the media reports. So that's this first intel comes from a media reporting. So that was definitely the first time I heard about a unknown cluster, if you like, of pneumonia in Wuhan. So that was the first sense that we got that something was happening. And the provincial territorial chief medical officers were then sent the same information.
Okay. Thank you, doctors. That concludes today's press conference.